Hi, I'm Dr. Ira Krafchin, a board-certified plastic surgeon practicing both in Clark Summit and Wilkes-Barre, Pennsylvania. I specialize in both reconstructive and cosmetic surgical procedures. Liposuction is a surgical technique that aspirates fatty tissue from selected areas of the body. It is not a weight loss procedure, although patients theoretically will lose a little bit of weight, but it's not for weight loss. It's for contouring of the body. The ideal situation and the ideal liposuction patient is somebody who is close to their goal weight. Now, goal weight varies from person to person. There's the insurance goal weight, which is, for a lot of people, is very difficult to get to, but I like to use the patient's goal weight. What can they stay at comfortably and live a nice lifestyle, enjoy themselves without suffering? So if they're close to their goal weight and they have these persistent areas that are bulging in the abdomen or flanks or thighs or whatever, then liposuction is beneficial for that. You don't want to have liposuction done because you're making an investment and then gain weight, because you can gain weight after liposuction. You may not gain as much in the areas that were operated on as you would have prior to the procedure, but you will gain it in other areas. So yes, you can gain weight and you can disrupt the appearance of the surgery. If you maintain your weight or even lose just a handful of pounds, it makes the result even better. The act of liposuction is physically removing fat cells from a specified area. So theoretically, the fat will not come back to that area. And as time goes on, if you do gain weight, you can gain it in the areas that were not liposuction. The body will store it elsewhere. My patient population tends to need perhaps more liposuction than others, and so I like to do it with anesthesia to make the patients comfortable. So therefore it's done in an operating room. It may be done in a hospital, but it doesn't mean they're staying in the hospital. They're just using the facility. In an office setting, you're limited with the type of anesthesia that you can give. Basically, in this state, you can only give local anesthesia, the same type of anesthesia that you would have a small growth removed from your hand. So it's very, very limited. In an operating room, you can receive sedation or even general anesthesia to make you more comfortable, especially if you have anxieties about surgery or are nervous. You can limit that very well with an anesthetic. And the people giving the anesthesia are all licensed, qualified, board certified people that I use. And we also have all the emergency equipment and specialties if there's a problem and needs addressing. Part of the process of liposuction is to compress the areas that have been suctioned, to obliterate them, to get them to heal down. It also helps the skin to recontour. So immediately following the surgery, we put patients in what we call compressive garments. Commercial names would be like Flexies or Spanx, but we use more surgical grade type garments to do that. And those stay on for at least a week or two, and then if the patients are comfortable, we convert them over to the commercial grade garments that they can pick up in any of the department stores to wear. And they're a little bit more comfortable, less unsightly. And what I find interesting is patients can't wait to get those initial garments off. And when they do get them off, they feel, you know what, I felt better with them on. So they switch over to the commercial grade and they can wear it under clothing. It's hard to detect. And then as they even get back into their exercise routine, they may still wear it for a while until everything continues to heal and mature.